All right. Hello, folks, and welcome to Able Cafe's Let's Talk Stress Management with our therapist and guest speaker, Ana Valenzuela. Hello, Ana. How are you?
Hi, I'm doing very well. How are you?
Doing pretty good. Doing pretty good. Thank you so much for joining us today. Before we kick everything off and get to it, let's talk just a little bit. We have a raffle that you'll be participating in. So what is that raffle and what will it look like for our participants?
Yes, I'm very excited about it because as we are talking stress management, I'm going to be raffling among the audience a 30 to 45 minute consultation with me, so we can kind of review what are the strategies or what's going on in one of the lucky audience live that can definitely use some strategies and some coping mechanisms and effective stress management.
Great deal. So, folks, make sure that you share the live and make sure that it is also public when you share it. That way we can see that you shared it and we can enter you into the raffle. The raffle will not be held live because we want to make sure that we maintain confidentiality. So we will also have the live take place on Wednesday, and we will message you if you are the winner. Okay. All right. So, Ana, please tell us a little bit about yourself.
Yes. First of all, thank you so much for having me today in your show. I'm very excited to reconnect with you and to be able to talk a little bit about this, especially in the times that we are experiencing right now. Stress management is essential and is at the forefront of everything that we need to be looking out for.
Right.
Well, as you said, my name is Ana Valenzuela. I am a licensed professional counselor in the state of Texas. I also hold a licensed chemical dependency license to practice in the state of Texas. And let me see. I've been here in the United States for quite a bit. As you probably noticed already, I do have a heavy accent. My first language is Spanish, as I was born in the Dominican Republic. So I am a Caribbean lady, very proud to be, from my beautiful Dominican Republic island. And my family and I migrated to the United States when I was 15. So it's been a bit now that I've been around. I like to say that I have the best of both cultures. I had the opportunity to grow and be a child and a teenager in my island, and then have the other part of my adulthood and go to school, get my career, and be able to to expand my wings here in this beautiful country, the United States.
Yes.
I also, let me see, what else can I tell you about myself? I have a master's degree in mental health counseling, and that allows me to practice mental health in the state of Texas. I graduated with a master's from Walden University. That's when I had the pleasure of meeting you.
Yes.
And I also have two bachelor's degree actually in psychology and sociology.
Okay.
And that allows me to kind of pay a little bit more attention at some of the social things that are happening in our country, in the world, as well as am I able to combine some of those things.
Understandable. Understandable.
Yes. So my work experience, since I graduated with my bachelor's degree, I worked a total of 11 years for the Harris Center for Mental Health and IDD, previously known as MHMRA of Harris County. I held different positions, within the company. I grew professionally, personally, and had an opportunity to work with various sectors of our community, providing mental health services, community-based services when I started. Then I moved on and did some clinical trainings and worked with management. Then towards the end of my career, or my tenure, I shall say, at the Harris Center, I was a clinical team leader, so I had the opportunity of teaching and guiding and providing mentorship to other clinicians that in what to do, pretty much, to serve our community. So that was a big chunk of my professional life, and I enjoyed it. And now I am very, very happy because I started a different chapter in my career, I serve as the executive director for Clear Hope Counseling and Wellness Center in the Pasadena area. Yes, it is very exciting because we are a still very small private practice in the Pasadena area, but as small as we are, we have 3 different locations.
Yeah.
In the greater Houston area. We provide school-based services to at least 5 different school districts in the area. So we do go out to the schools and see the kids that are needing assistance, rather than putting them out of school. We are able to go in and provide the services right there and there and have that connection with the teachers and the administration and things like that. So we can assist to the best of our opportunities there at the school.
So you guys go into the school systems?
Yes, we do.
I love that.
Yes, we do. We have our school-based services. We cover, for those of you guys that might be familiar with the Houston area, we cover the Pasadena school district, which is very close to 2 of our offices. We cover LaPorte, the city of LaPorte School District, Fort Bend, Independent School District as well, Galena Park, and we cover also the Children's Harbor, which is an agency that provides services for kiddos out in foster care. So I'm very excited. So we have a wide range of services that we provide for children, adolescents, and adults in our offices and as well out in the community.
Nice. Okay. So thank you for all of those credentials. I mean, you're doing a lot. As you said, or as Ana said, that she is in the Houston area, which is one of our biggest cities in the great state of Texas. So you're providing some awesome services there. As you all know, today we're talking about stress management and what that looks like. So before we dive into some of the questions, what exactly is stress? What does stress mean?
So let me go ahead and share a little bit of a small presentation that I put together so we can get some visuals of what we're talking about. If the audience wants to go ahead and take some notes, they're able to go ahead and do that as well, especially when we start talking about definitions and we start talking about symptoms, which is very important to be able to pay attention and have handy. So as you talked about, when we talk about stress, or even to begin to know how to manage something, we need to know what we're talking about.
Right.
We need to be able to have a definition and be able to say, okay, this is what I'm looking for. This is what I'm talking about. So when we talk about stress, we looked at a feeling or emotion or physical tension. We're looking for, different things that can manifest in very different ways for different people. So we say that it is, as I mentioned, a feeling of emotions or physical tension. It can come from any event or through, that can make us feel very frustrated, angry, nervous, and can bring up a lot of different feelings depending on what's going on and the level of maturity that the individual, has. You'll see different presentations from children, different presentations from adults, adolescents, young adults, the elderly, or even, individuals that are in the, as we like to say, the level of maturity that they're reaching. So, and it can present in many different ways. So your body will have some type of reaction to different challenges and demands that can be happening. We as individuals may experience, short bursts of feelings and emotions that is very difficult for us to understand.
Right.
And that's what we want to be looking at. What exactly is it that is different, pretty much. Now, it is very important to point out that stress is not always negative. Right. We do need to be able to have some what we call positive stress, that can help us avoid danger, or that allows us to meet deadlines, that we may have at work, at school, at home, or in different of the different life situations that we may have. So once we have that ability to identify what is positive or negative stress, it is essential and is very helpful.
Gotcha. Okay.
So normally, as I mentioned, we hear that stress is bad. We don't want, we don't want to be stressed out. We want to try to decrease as much as possible our stress level. And that is correct, because whenever we have ongoing or chronic stress, can cause or exacerbate many serious health problems that include mental health problems such as depression, anxiety, personality disorder, bipolar disorder, schizophrenia, PTSD, or any other symptoms, ADHD as well. So some of the major diagnoses that we see in children, adolescents, and adults. So when we talk about physical, we looked at any cardiovascular disease, including heart attacks, high blood pressure, normal heart rhythms, strokes, even gastrointestinal symptoms that can be definitely exacerbated by stress.
Okay.
There are sometimes that we hear, ulcers can be caused definitely by stress. And of course, I'm not a medical doctor, right, but there's some truth, into that, especially with the symptoms that we can experience, in our gastrointestinal tracts and our system when it comes to stress. Okay. One of the things that I like to say that is essential to remember that because people handle stress differently, symptoms are going to vary from person to person. And symptoms can be very vague, especially if the individual may not have the vocabulary to be able to express exactly what is happening and the emotional maturity to be able to say, oh, this is what's happening to me. Or, wait a minute, this is stress, and be able to recognize those symptoms that are associated with stress.
So can I ask a question then? So that's a great point. If they're not able to vocalize exactly what they're feeling or, what it is they're going through, they know that something is happening, but they don't know how to put it into words. What does that look like? Like, how does that affect, and I might be moving a bit too fast. How does that, what does that look like? How would that look on the outside?
And that's why it is essential to be able to pay attention to the different symptoms and get to know the individual. For example, for parents that are having kiddos at home that are dealing with everything that is happening in the pandemic that we are experiencing, the current social and difficulties that our nation is experiencing for African Americans, Latinos, Indians, Asian people, and the different cultures that are experiencing difficulties in our country in this moment. It is essential to pay attention to changes in the habits, sleep, eating, anything that is unusual and that can look different, for the child. It is essential for parents to pay attention and kind of ask questions and get the ball rolling, with the information that they're able to see. Okay. Same thing for adults. Check into, with those people that we have around us and be able to pay attention to sort of those invitations that people give us that kind of feel like, well, that's unusual. This person is acting a little bit different. So let me find out what's happening and try to figure it out. How can I help? Pretty much decode everything, that person is experiencing at that moment, because they may not know.
Yeah, absolutely.
Absolutely. So, and that leads us into, talking about some of the symptoms and more, details specifically when it comes to stress. And as I mentioned earlier, there are different levels that we need to make sure to pay attention to. You may have the emotional symptoms, and those are becoming easily agitated, frustrated, or moody, especially if that's unusual, for that person.
Right.
And again, this is not something that we will say, oh, It only happens to kids. It only happens to adults. It will only happen, to young adults, teenagers. It's across the board.
Yes.
You will see symptoms that are manifesting very similarly across the age span, and it's essential that we pay attention to those things. Feelings of overwhelmness, like you're losing control, or that you don't have control of what's happening, or vice versa, that you want to have control. Right. And that might be unusual, because you may have somebody that is, for the most part, very easygoing, is somebody that is a very resilient, as we will say when we're referring to traumatic experiences. And out of the sudden, you see that person is very attached to something and wanting things their way and wanting to have control, right, of what's happening. So that can go either way, and it's essential to pay attention to it. Okay. Having difficulties relaxing, or pretty much slowing down and getting to a point that they can quiet down their mind. You will see this type of things, especially these feelings, as if you have someone that is sitting down and trying to watch a movie or TV or something like that, a favorite show, and all of a sudden they're on the go, and they can't stay still for to enjoy or to relax, because they constantly have to be on the go. And that can be a shift in the norm for this particular person. Okay. Experiencing low self-esteem, like feeling loneliness, worthless, and depressed. Something to especially in these times that we're living, where isolation is the number one thing that we hear. Stay away, 6 feet apart. Don't get out of your house. Stay quarantine. Isolation during the pandemic has become a norm, but it's something that for mental health we know is not. And it's definitely causing a lot of repercussions, and we will continue to see a lot of repercussions, in our society and in our communities as a result of the pandemic. Okay, ready?
You'll hear the ding. That's messages and questions for you. Okay.
Oh, that's great. That's great.
They're sending them to the messenger box.
Perfect. Yes, we definitely will do our best to answer all of those questions. Something else, Miranda, that is very important that we pay attention to is the physical symptoms that we might experience. And for the physical symptoms and the emotional and some of the cognitive symptoms that we'll talk in a little bit, there's a lot of overlapping of them, because they can present in different ways. For example, physical symptoms can be low energy, headache, upset stomach, aches and pains, tension in your muscles, especially in this area, your neck, your body, lower back, chest pain and very rapid, heartbeat, insomnia, frequent colds or infections, or that sensation of chills, that that something is not going right in my body, and my body's definitely telling me that I need to do something about it. Feeling nervous, shaky, kind of feeling that, especially at night, whenever you're trying to sleep, this portion you're clenching, your jaw, and as you're sleeping. And a lot of these physical symptoms, as a mental health clinician, overlap with depression. These are the symptoms of depression. Right. These are the symptoms of anxiety. Right. Yeah, these are the symptoms, that we look when we assessing for PTSD as well. So it is essential to pay attention to these things and how stress can manifest as a mental health diagnosis. And if it prolongs and it goes untreated, or we move on without paying attention to it, it can definitely lead to more serious mental health illnesses.
And that's a good point. Sometimes with all of these symptoms that you see here that you just mentioned, some of them, some are missed. They're hidden because you think, oh, okay, yeah, why am I biting my jaw, or why am I clenching my jaw? And you have to or, laying down at night and, they're like, okay, I can't sleep. Let me just scroll Facebook, and it just becomes a thing, and they don't associate it or put it put it with, okay, am I possibly stressed? So these are a lot of things that are overlooked as, something that could possibly just be the norm.
Correct.
So,
correct.
Okay, that's really good stuff.
Yes, indeed. And if we throw in there the cultural aspect, of experiencing these symptoms, especially for, coming from the Latino community and, Afro-Caribbean, Afro-Latina, I know that we may experience these symptoms and it's like, I just have to keep pushing. I push through. I got to work. I got to take care of my family.
Right.
There's things, that I got to do. And we tend to ignore these type of symptoms and just because we work so much, because we have so much going on in our lives that we attribute it to it. But of course, yes, it is stress. And if we just continue pushing through and moving through the motions, it can definitely be very debilitating and cause many, many other issues.
Absolutely.
Yes,
absolutely.
Indeed.
I agree.
The next set of symptoms that we have is the cognitive symptoms. And as we talked about, the physical symptoms can pretty much overlap a lot with our cognition as well and impact directly our cognition. But some of the additional ones that we can pay attention to is constant worrying that something bad's going to happen, and the worry that something bad's going to happen to me. And as the provider of my family, as the caretaker of my family, as the one that pretty much holds everything together, I don't have the luxury. I can't get sick. So therefore, I have to push through and just go with the flow, pretty much. Yeah. Racing thought, especially as we are laying down at night, to try to rest. And then we are pretty much starting to think about everything that we didn't get to do that day, or that we feel guilty because we didn't finish or we didn't accomplish, for that day, especially if it has to do with our family, work, or things that we have pending, our friends and things like that, and things that we have for the next day. Okay, I have all of these things that I gotta do, and before you know it, rather than sleeping, you're thinking about, I gotta do this, I gotta do that, and before you know it, you have 3, 4, 5, 6, 10 different thoughts in your mind, and you're unable to, to fall asleep.
Right.
Okay? Forgetfulness and disorganization. If we're not sleeping and resting appropriately, it's going to be very limitations for us to stay on task, pay attention, and be able to stay on top of the different things that we have to do.
Right.
Poor judgment, definitely something that can, especially if stress is prolonged and we don't do something to take care of it, we are going to start realizing that our decisions may not be, the best decisions that we're making, or that we're not paying attention to everything that we need to pay attention to.
Right.
Being pessimistic or seeing only the negative side. It is essential that we pay attention to that, because if we are only surrounding ourselves with negative thoughts, that is what we're going to see everywhere. So it will be very difficult, for us to look at the bright sides of things if we're exhausted, if we are stressed, and if we're experiencing some or at times all of these symptoms.
Right.
And lastly, we looked at the behavioral symptoms. How does everything else, those physical symptoms, emotional symptoms, and cognitive symptoms, how do they present? And our behavior is what other people see. The things that, that we are pretty much, how are we showing up, for ourselves and for others and for our community as well. We see changes in appetite, either not eating or eating too much, procrastinating and avoiding responsibilities, like knowing that I need to do this, however, I got time. I still have a few days, I still have a few hours. Well, let me just push it a little bit, and before we know it, we have a deadline on top of us, and then there we are, overly stressed, or with more stress because we didn't do it on time.
Right. Absolutely.
We also see some increase of alcohol, drugs, or even smoking, cigarettes, or vaping, or hookahs, or all of these tobacco products that the individual, may see it as calming in ways to relax. However, prolonged is just debilitating, more debilitating, and then just causing more harm than good.
Yeah.
And lastly, we have exhibiting more nervous behaviors such as nail biting, fidgeting, and pacing. And irritability, as we know, we talked about that as part of the physical symptoms. That's how our behavior, show up. We're yelling, we're screaming, we're slamming doors, we are irritated and grumpy, and then just anything as small as somebody may say to us, that is just the last straw, that we have for that day. And before we know it, then we are having arguments and disagreements and seeing things where they're not really are. Because of the accumulation of symptoms that we are experiencing.
Okay. All good stuff. Excessive nail biting. That is interesting. Of course, we all know someone who either does it or who has done it, things of that nature. And you don't just necessarily think, is this a sign of stress or anything like that? But these are all some really good points. I'm loving it. So with all of this, if we can talk just a little bit to the parents, you have quite a few parents. 2021 is getting ready to come. It's about to grace us with its presence. And with that means graduations are getting ready to happen. That means right now students are preparing to go to college. They're either looking for schools, and they may have questions. But there's also a certain amount of stress that comes with it when it comes to the parents.
Yes.
Some parents may not know where to start. They just may not know how to talk to their kids, or they may not even know how to they have a lot of things that they're questioning. I'm getting ready to have an empty home. If it's the only child, or if they have a set of twins, or if this is the last child, they're getting ready to experience the empty nest syndrome, and so the thing is, here's my question. With all that we've talked about when it comes to stress, what are some tips and strategies and tools that we can, give to parents as they prepare for either, their child to leave the home, paying for college, and just maybe some preventative measures, things that they can do to prevent that stress?
One of the things that I like to recommend is awareness. And if you notice, as I was talking about the different symptoms and things like that, it is being able to know yourself, be aware of what's happening, and be honest with yourself, knowing that this is real and this is happening, and give yourself permission to experience the feelings that are happening. Your child is leaving for college, and the especially the economic impact that may have in families. We have first generation of kiddos that are going to college, that their parents may not really know how that system works here in the United States, how expensive it can be, and how to prepare for it, as you mentioned it. So the awareness of this is what's happening, this is the reality that we're facing, is the first step. It's the first step to be able to say and give yourself permission to know it's okay not to be okay. It's okay not to know all the answers. It's okay, that I need to reach out to perhaps the university, perhaps the counselors in the campus, with my child. That's another thing, to keep in mind, that normally through the normal education, first grade to even senior year, parents are very involved in the education. Parents talk to teachers about it. Parents email teachers. Parents go to meet the teacher, and they're very, very involved in everything that is happening in their child education.
Right.
Once the child goes to college, it may be a 2-year college or it may be a 4-year college. That's not happening anymore. Because by law, the teachers, the professors, they're not able to give parents any information. So being able to know and prepare and have that conversation with your child of the changes that are going to take place and starting early on. Senior year, the beginning of senior year, the end of junior year, let's start talking about what are you going to do? Where do you want to go? So we can start raising that awareness and opening the communication of the changes that are coming. That way things don't catch us, don't catch us. With like before we know it, well, here it is, and there's nothing that we can do because it's here. So awareness, preparation, as much as possible, of course. Gathering information of where we're going, what are our possibilities financially, community resources, and what are the changes that as a family we're going to be experiencing comes all wrapped up in that importance of being aware.
Okay. Really good. And so, and I know you have some info too on that.
Yeah. So let me pull a few tips, that we can add to that awareness for stress management. And this can be overall for the child and for the parent as well. So being able to recognize the warning signs of excessive stress. As I said, self-awareness is the foundation of stress management. If we don't know what's happening, if we're not aware of what's happening, there is nothing that we can do. So paying attention to those signs or symptoms that we previously talked about is going to give that base to try to figure it out, okay, what is abnormal in here? What is different? How is my behavior presenting differently? And if I don't have the self-awareness or I'm not, as an individual, I'm not noticing it, being open to the people that are around as I mentioned earlier. Tip number 2, self-care. As a mental professional, we encourage and push a lot of self-care and the importance of self-care for everyone. Exercise, and not only mental health professionals, say health professionals too. Exercise is wonderful across the board for your mental health as well as for your physical health. Connecting with others, friends, family, networking, going out for a walk, even if it is by yourself, or going for a bike ride, so you can think and expand your horizon and expand your mind. Taking breaks and time away, being able to take some me time. Those moments that at times, depending on everything that we're having going on, we might feel that we don't deserve to take a moment, for myself. And that can be very simple. It could be, I'm going to sit in here for 5 minutes and then just do nothing. And I deserve that. Just take a deep breath, 5 minutes, and then I can keep going. A little bit after, 5 more minutes, and before you know it, you have sit down and spend some time during the day just for yourself. What we eat, it is essential for our physical health, for our mental health and emotional health too. Drinking, as I talked about earlier, sometimes we may think, especially as alcohol is a socially acceptable way of decompressing and relaxing. However, it is not a very healthy coping skill that we want to be able to implement because alcohol is a depressant.
Yeah.
You know, it depresses your system. And then that's why you may see people that whenever they are under the influence, they're crying, or they are very aggressive. You know, it can go from one extent to the other. Monitoring your sleep. You know, it is very important to do that. Trying to get as much sleep as possible. Enjoying cultural or spiritual and social activities.
Mm-hmm.
Going to church, you know, joining a life group or a Bible study group.
Mm-hmm.
If because of the pandemic, a lot of people have lost the ability to go to their church, but a lot of churches are doing the live streams, just like as we're doing right now.
Yeah.
So taking advantage of that, and even though it may not feel the same, it is a little bit of taking that in for spirituality and connection. Okay. Knowing your limits. That is establishing boundaries and being able to say no. I'm not even if it is to myself. No, Anna, no, I'm not doing this. I really want to help.
Yeah.
And really, want to be there for this person or for this activity. However, I'm not capable at this moment. And that goes hand to hand with that self-awareness.
That is good. Especially the me time that you mentioned and knowing your limits. You know, a lot of times, individuals do not set boundaries because sometimes, you feel like, oh, they asked me this, I need to do this, or you feel obligated to do it, or, when it comes to me time, if you're either in a relationship or if you're not in a relationship, sometimes there's the guilt there that's, okay, I'm taking my me time. Is that right to do? Is that okay to do? And I'm a big believer in me time. You'll hear me saying, oh, I need my me time. You have to get away. So I hear you on that. Boundaries is a big thing that, we all need to learn how to set that word no and be okay saying no.
No, yes. And with that, it comes giving yourself permission.
Mm-hmm.
I talked about that at the beginning, being able to, to say, this is what I need, this is what I deserve, and it's okay. It's okay for me to say no. It's okay for me to get this little time. And it comes, you've mentioned a great question earlier when you said the empty nest syndrome.
Mm-hmm.
Many people don't realize that that's a real thing. And it can impact very severely, really, because you spend the vast majority of your life caring for somebody else, caring for your child, caring for for their well-being, for everything, and then realizing that this person is what you created. You taught them, you pushed them through, you set the examples, you did all of these things, and now it's time to fly. It's like, what am I going to do now?
What is my role?
What is my role?
Yeah.
What's my identity at this moment? I am the parent. It's well said that whenever we become parents, we lose our identity. We are somebody's mom, somebody's dad at this moment. It's not anymore, this is who I am. So it's very important that we, as parents, we know that if I'm not okay, my kiddos are not going to be okay.
Right.
And that prepares us, as we grow with our children, for that moment, for them to, to leave the nest, and for us to be able to say, okay, what do I do now? Yeah. And with that is practicing these activities that are here, to find, that sense, and knowing that we're never going to stop being the parent of this person. Right. This person is always going to be part of our lives. However, now I need that me time. It's my time to enjoy and to pick up the fruits of the great work that I did, for this human being that is, flying and going to do great things.
Right. Right. The key word, give yourself permission.
Yes. Lastly, for some stress management techniques, I have, tip number 3, is being able to create a balanced schedule. And that comes, with that preparation that I know that eventually, my kiddos are going to, especially for empty nesters or these parents that the child is the first generation of college, the first one in the family that's going to be going to college. So I'm trying to create that balance, in the schedule, to be able to say, in incorporating time with your child, time with, with family, time with friends, and time with me, and being able to balance, that. Again, awareness, awareness. Be aware of stress by observing your muscles, um, insight, and and your how you have your breathing, changes within you, listening to your body. Your body is your best friend, and your body is gonna let you know. There's a great book about trauma that's called "The Body Keeps Score," and it's pretty much just letting us know we might move on with our life after experiencing different things in our life, but our body will always remember what happened, and we might push it under the rug. We may just move on, but our body, if we listen closely, will let us know something is not right.
That is true.
Okay. I talked about give yourself permission, to acknowledge that not being okay is okay, especially during this time. Pandemic, weather, like right here down in the Houston area, we are under a tropical storm right now. As I speak, is raining outside.
Yeah.
So 2020 has been a tremendous year for all of us. So adopting that new normal and saying, I'm not okay, but that's okay. Right. And I just need to figure out what I need.
Right.
So I can continue moving forward. Seeking professional help, that's what we're here for. I am very happy, to say that as a mental health professional that speaks English and Spanish, I'm a true advocate for my, especially Hispanic community, to go talk to somebody. Let's break those barriers. Let's break those taboos that come that you don't need to talk about your problems and what's happening in your life to strangers, because we do. There's a lot happening in our lives that we need somebody to talk to, somebody to listen, somebody to say, it's going to be okay. And these are strategies and things that you can do. And I'm going to walk with you through it.
Awesome. And I'm glad you mentioned that, and it's the same. There's a stigma that comes with, going to see a therapist. Sometimes people think, oh, well, what's wrong with you? Or, oh, Lord, she's dealing with this. And, and it becomes a shameful thing. And when it's really not anything to be ashamed of. There's nothing wrong with, preparing your mind for whatever is going on. So just as if we would exercise to get our bodies in shape, it's important to exercise what's going on in your mind, or what's going on, mentally. It's something that is, like I said, an absolute stigma, especially also in the African-American community as well. It's just not something that you do.
Correct.
Then when you do it, it's like, oh, well, this helped.
Exactly.
I feel different. I feel better, So I'm glad you mentioned that.
Yes. And, as I talked earlier, the spirituality aspect of it is essential as well. We and I know this to be true in the Hispanic community and African American community, that we're very religious, we're very faithful, and we tend to say, well, God will take care of it. And I'm sure, yes, I as a Christian, I know God is with me and God will help me through it. Absolutely. However, God also wants for me to find help, the assistance that I need to be able to walk through the path of any hardship and things that are happening in life, and getting that support. Absolutely. So it is essential that we find that combination of our spirituality, our religious belief, our culture, but also seeking for professional help, especially whenever we are having a hard time.
Understandable.
Patience is a highlight as well, just like self-awareness, especially with whenever we have kiddos, that are in the transition, that are in a transitional period of, let's say, finishing high school and moving on to college, or finishing their bachelor's degree and deciding, that they want to pursue a master's or a doctoral degree. It is a transition period, and the more you go, the more financial worries come with, as well as the more responsibilities and more knowledge
Yes.
you're going to be obtaining, so it becomes more difficult. So being patient and knowing that time is precious, and it's something that we cannot replace. However, patient is golden. If we're patient, we're able to accomplish a lot of our goals.
Gotcha.
Listen, give space, make yourself available, realize that feelings can change drastically, especially, whenever we looked at all of those symptoms. And depending how much stress and how many different parts, are playing, how many hats as individuals we're wearing, that is how much stress, we're going to have in our life. And the vast majority of us, we are professionals, we're parents, we're friends, we're daughters, we're sisters, we're cousins, we are a great deal of different things, and we have to wear different hats in different situations, and that is stressful.
It is.
Yes. So alertness and encouragement. Now, those are some things that we definitely need to, to pay attention. We're made alert to any changes in behaviors or mental state. Encourage each other to share, our feelings, as needed, and be there to support and to check in, with each other.
Very good.
Yes, ma'am.
Very good. Stress management techniques. The encouraging each other, especially during this time here. The pandemic, it's shut down so much, where you used to be able to go to brunch. You could go to brunch with your girls and say, hey, check in, or hang, or just go to the house. Now all of that has been, shut down until recently. Things have been slowly opening up. But, things are shut down. And so during this pandemic, you've just been in your house. You've just either been working from home, you're working from home, you are, there's parents that have kids and they're having to do the virtual learning. Homeschooling is so much, whereas before you could leave and go to work. You wasn't worried about what was going on at home. And then you come home and then you figure it out then. Now it's all compact, it's all in one. And so, people are having a hard time, saying, okay, how can I compartmentalize each one of these? How can I differentiate between each one of these when we're all in the same house? And so being able to talk to others is definitely well needed. So that's even picking up a phone. I'm glad that they created, different apps that you could use during the, pandemic. I think one was called House Party, where you can, meet with your friends and play games on there, or just simply FaceTiming or Duo, Google, however that goes, but yes, encouraging each other.
And one of the things, that and the encouragement is checking with your strong friends. Yep. That is a highlight that I've seen over and over, with the pandemic, because, whenever you do have those people that are strong and they take care of things, they're constantly on top of things. Whenever isolation and a compilation of different things, and we lose that ability to have a structure, to be able to do the things that we normally do, that's whenever we start seeing an increase in stress, an increase of the different symptoms. So check on your friends, especially those that are the strong ones. So
right, those who typically listen.
Yes.
Yeah, I gotcha. So with that, so we talked a little bit to the parents. When it comes to the student, and I know that some of these, or the majority of these, actually can apply to students that are getting ready to leave the house too. But let me ask you this: what tips would you give students who are, preparing? They're saying, okay, I got to get ready to leave the house. They're uprooting. Now, some are very excited to leave. They're like, okay, I'm about to get out this house, so they're very excited to leave, and then you have some that are just thinking, they're like, okay, what is this about to be like? This is a whole new area, a whole new town or a whole new state. You just never know, like whatever that aspect is. What tips can you give them as they are in their senior year to finish it out and prepare for, going into college or life, even if they're not going into college? what tips can you give them to manage that stress?
I would say develop, or if they have not done so, and if they have, maintain strong connections with their family.
Hmm.
Because even if you are awake, the great thing about technology nowadays is that you can continue to stay connected.
Absolutely.
Even if you are eager, to get out of the house for whatever reason,
Yeah.
we may have, all kinds of excitement and reasons for leaving the house, but stay connected. Don't forget where you come from and in the roots, of where you are. Because of the sacrifices, the efforts, the support, or lack of support,
Yeah.
depending on the situation, of course, of the people that that you leaving behind. So it can be friends, it can be neighbors, it can be coaches, it can be friends in school. So remain connected with someone that reminds you and can allow you to stay grounded to what you had before you went to college, or you went away, or you started working, or you moved on to the next level of your life. Become aware and familiar. Let's say if you're going to a college campus, what are the activities on campus? Where are the organizations that I can join? Where are places where I can feel that I belong? That people that share some of my own interests, and what new interests I can start developing, so I can keep myself busy, that I can keep not only busy with the classes and with the new responsibilities, but at the same time with connections.
Right.
Get to know your the school counselor, or I shall say the school council, the university counselors. Each university, each campus has a mental health, or should have a mental health department. And it's true for international students. It's true for students that are coming from within the state, from out of the country. There are counseling services in the campus. So familiarize yourself with that. And keep in mind the symptoms that we talked about. So if you need to, you're looking at, okay, this is what's happening. I'm seeing some changes. I'm having difficulties adjusting to the change. I need to go talk to somebody. I need to go, check in with, the counselor at the campus that I am, so I can figure it out how to develop connections, and how to stay on task, and how to overcome the difficulties that I'm having with the changes.
Excellent. Definitely joining groups, because a campus is so big, and for a freshman, depending on, if it's a state school or community college, no matter what, it's still a big school to them. And I mean, you don't know where what is. Everyone knows who you are the first day of school, because you're just out there looking. You're looking for that building. You look lost. And so that was a great point to become involved in different groups and activities. I know one thing that helped me get acquainted with my school as a freshman was joining FYE, freshman year experience. And so we were able to learn who our president was, the dean, all of that, and what buildings were where, and then I also worked at the school as well. So that did help, because it helped you become comfortable in a place that is just so big. So I definitely agree with that. So when it comes to protecting your mental health for both the parent and the student, how could they possibly protect that as they're away? I know you said staying connected and things of that nature. How else? Because, of course, there's different things that can come up. Let's say, let's separate the two. So let's say for students, the unknown is already happening. They're getting in touch with who they are. They're also beginning to date. Pop parties, different things. There's different things that go on. And then you have the parent who is dealing with, should I constantly check in on my kid? Is it okay to call my kid every single day? They have so many questions. How can each protect their mental health?
I would say that for students, being aware of what's happening and any changes that they are experiencing, and being honest, to themselves. I know that in going away for college, or even going to to a community college, even if you're staying at home, you don't really want to for your parents to worry. You don't want for them to be more preoccupied, or add more, feel like you're a burden to your parents. However, it is essential to be honest, to check in with yourself, and be honest to yourself, and allowing and giving yourself permission to know that this is different. Yeah. I'm experiencing it. It's an exciting part of my life. However, I'm afraid. Right. And if that's really what's happening, be honest and say, yes, I'm afraid. And if you don't want to, talk to your parents about it, that's why connections are so important. To be able to have, someone that you feel comfortable, you feel safe, talking to. That can be, someone from the past, someone that you left behind. As you were in high school, you guys were very good friends. A coach, a teacher, someone that you developed a very good relationship prior to going away, that you can reach out to. Groups, there are support groups, that you can reach out to and build that connection. So becoming aware of the community resources that are around you, and being honest with yourself to say, something is up, and I'm not feeling right. And it's okay not to feel right, because a lot of changes are happening at this moment. And it can be the opposite. It can be, I'm fearful, I'm afraid, I have some symptoms, that are pulling me down. I'm not sure why. I'm feeling with no energy. I'm feeling that I don't fit in. I'm feeling, this sense of sadness, or it could be the opposite, feeling overjoyed, to the point that is abnormal. For me as an individual, I'm feeling this sense of euphoria or excitement about things that are unusual for me. So those are things to also pay attention to, and be honest to yourself. Okay.
Okay. And for those who are still watching, make sure that you send us your questions. You can either send it to our the message inbox, my message inbox, or you can send it within the broadcast as well. So another question for you, moving on, I guess, to a different portion. When it comes to being licensed as a licensed therapist, what was your process? What did you have to do for those who are interested in becoming a therapist?
Yes. First is being able to do the research and talk to someone that is doing the job already. Because in order to be a mental health professional, there has to be the passion. You have to want to do this line of job. I always like to say that if you want to become a millionaire, this is not it. Social services is not for you, because that definitely the amount of work that we do in this field is definitely not, especially for state in the state of Texas. I shall say we fall short. When it comes to salaries, in our field. So you have to have the passion. You have to have the push, to be able to help other people, and to be vulnerable, with your population and the people that you want to serve. Then of course you have to go to school. You have to get a bachelor's degree in some type of social services. It has to be psychology, sociology, anthropology, some area where where social services is. Then you go and get a master's degree. In my case, I have a master's of science in mental health counseling. Take a lot of courses, that prepare you for to be able to to counsel and to be there for other people, and you learn the skills. Within the master's program, there are internship and practicums that you have to do. Different universities may have different requirements on how that looks like. In my program, I had to do 100 hours of practicum and about 650 hours of internship, and that's non-paid. So that is while you are in your master's program. Then here in the state of Texas, we have to take a test, or two tests actually. The first test is the National Counselor Examiner, the NCE. I'm much better with acronyms. We have to take a test, to be able to say, yes, I learned something in my master's program and I can remember and I can apply it. And then, yes, I'm ready, to do another practicum and another internship, I shall say. But once you pass that test, there's the other one that's called jurisprudence test, and you apply to become whenever I did my license, it was licensed professional counselor intern. Recently that changed to associate. So it's a licensed professional associate. Nice. And then you hire somebody to supervise you. And you find a site where you have to do the 3,000 hour, 1,500 direct and 1,500 indirect hours as part of the training. Have to meet with that supervisor at least once a week, face to face. Some can be video, but there's some variations in there, and you have to pay that person to supervise you. And then once you finish those hours, you are able to apply for a fully licensed.
Okay, awesome. Okay, that's a lot of work. Sounds like
it is a lot of work. It is a lot of work, but it's definitely worth it. It is the pleasure and to be able to be able to be there, for someone, and be able to be held accountable as well, as a professional, because I have to continue to do continuing education. I need to be able to continue to research and continue to read and continue to become better as a therapist. Even as an executive director for Clear Hope Counseling, our motto is that everyone that is in a leadership position needs to see clients as well. Because as a leader, I need to be able to know that I'm leading my team through the correct path of what's happening, with the skills and with the changes in policies, with the changes in the different areas of counseling. So I do have a caseload as well, so I can continue to lead my team as a leader for them.
Awesome. Okay.
Yes,
and you're doing great things in Houston.
Learning is never ending, so we're always learning something new.
Absolutely. Absolutely. So I'm going to ask a few questions concerning the pandemic. So we talked about the college portion, but when it comes to the pandemic, as we stated earlier, a lot of things have changed. You have, like I said, parents staying home and homeschooling, and things are just so different. The norm now is to be home and to just dwell in the unknown, because we don't know what's happening, from day to day. We just do not know what's going on. You have a lot of new moms that are out there that have had, that have given birth during the pandemic, a little bit before. So, family involvement has been shut down a bit. That's a stressful process for, quite a few people, and those who have, already have anxiety, they're having to manage that and cope in different ways. Before we get off of our live, and in a few minutes, I'm going to go ahead and ask you some questions that have been sent to us. Going forward, as we continue, with the unknown of this pandemic, what can you tell those that are watching, like, as far as managing that and on the day-to-day, the unknown portion, just where do we go from here?
It is very interesting that you bring that up, because one of the things that we do for Clear Hope Counseling is that we also do training. The leadership group, a couple of months ago, we put together a training that is called A New Normal. And that can be accessed in our website, clearhopecounseling.com. In the new normal, just put together different techniques and different things that are happening as we embark in the unknown. And in these areas where we really don't know how, what's going to happen, when it's going to happen, when is it going to end, and if if things are going to be back to normal. And
Yeah.
at this point, after 8 months
Yeah.
of the pandemic, what is before? So one of the things that I like to recommend, and it goes hand by hand with what we have been talking about stress management, is being able to find a balance in knowing that chaos creates more chaos. You know, if we are constantly looking about what we used to have and what we have now, and fearful of what's going to happen next, we are just going back and forth in a process of mental and emotional chaos. And we need to make sure to know that our kids are looking after us. If I'm stressed, if I am confused, if I am fearful, my kids are going to be. Of course, we want to be honest with our children, regardless of what age they are. They can be 2 years old, 5 year old, a teenager, an adult, and be honest and say, this is how I'm feeling. I may not know the name of that feeling, but I am feeling a knot in my stomach. I am feeling, a headache. I am feeling, my throat that is, chopped, my chest hurts, and naming those things and being honest to what is going on, and being able to find a balance that works for you and your family. It is essential to know that what works for me in my house, to be able to manage and balance what we are going through, is not going to be the same that's going to work for you.
Right. So what would that look like? So if they, let's say for instance, they're like, would they write that down, or they just need to take this me time that we spoke about, take the me time and say, hey, okay, the other day when this was going on, I felt this way. Okay, what can I do? So like if they have the knot in their throat, if they have the, maybe heavy breathing, or the, heaviness on their chest, how can they, like, how can they distinguish that? Like, what does that look like as far as, go ahead.
Well, I recommend journaling. Journaling is one of my favorite strategies that I recommend to all of my clients, and I practice it myself, regardless of the diagnosis, regardless of what they're coming in to see me. I recommend that. It's the first thing that I invite my clients to do. Go ahead and journal. And journaling can be anything. It can be, I have words, I am drawing, I am scribbling because I have so much going on that I don't even know what it is. And then once that is out, you're able to see, okay, this is what's happening. Okay, this is what, it's not all in my head anymore. It's visual. So what can I do? Do I need to stop at this time so I can sit down and play a board game with my kiddos? Do we need to, I see that I get frustrated whenever I'm helping my son or my daughter with their math homework because I don't understand it. Am I the best person to help with that? I know in my house I'm not. So I find somebody else that might be able to, like my husband, my sister, that I can reach out to, and they might not be able to be physically in my house, but I can call them on the phone. I can do a video conference, with them. I can send them a text. Hey, can you, find out, do you know how to solve this problem, or what's happening? So maintaining those connections for people that are outside our home or within our home that might be the best to help with that particular situation. Okay. Engaging in some type of movement, exercise, we talked about that. Incorporating the family, maybe something is happening that is overstimulating, that we feel it, that something is happening, that we are all worried, we're all stressed. Okay, stop everything. Let's go for a walk if we're able to. Let's go to the backyard. Let's go sit in the front yard. Let's play video games. Let's dance. Let's do something to get our mind out of it. And then we can resume whatever it was that we were doing.
Okay, very good. So in some portions, delegating, asking for help.
Yes.
Okay, so which is good, because sometimes we don't always delegate. We don't always know how to say, okay, I cannot do this. And sometimes we do say it. We may not even say it right. And so it may offend the other person, but the delegation part, the delegating part, and asking for help, is very vital during this time. So I'm very glad to see that.
And knowing that it's okay to do that. It's okay, to ask for help. And that's sometimes we struggle with that, because I got it, because I can do it, because I can push through, I got this. And it's that level of awareness, and that level of giving yourself permission to say, nope, I don't have it. I don't got this. I need help.
Yeah. Can you say that one more time, that it's okay? Let them know. Let them know.
Yes, it is okay not to be okay. You don't have to not to have all the answers. It's okay to give yourself permission to say, nope, I don't got this, so I need help.
There you go.
Yes, indeed.
Awesome. Okay, so I'm going to ask you some of the questions that have been sent to me here. And some of them, we've answered, but we'll just go ahead and answer them again if you don't mind. So let's see here. Let me go back down. Someone says, so what are some tips to help your child handle stress? So let's say, so let's just say, I guess, 5 to 18. Even though kids beyond that, but below that age can have stress as well, but
of course.
Yeah. So how would they handle that?
I will recommend finding rather than telling, especially a child that is very young, let's say 3, 4, 5, even 10-year-olds, even teenagers at times. No, we tend to use the words, use your words. Tell me what's going on. But we need to realize that sometimes they may not have the words. And that's, what I said earlier, it might be that they can tell you where in their body they're feeling, whatever it is that they're feeling. Is it in their stomach? Sometimes they may say, oh, my stomach hurts, or my back hurts, my shoulders hurt, my head hurts. Okay, well, tell me more about that. Being open and being able to ask more questions, in helping the child, the teenager, realize that whatever they say is hurting them, it might be, symptoms of anxiety. That I know you have these different symptoms that we have talked about, normalizing it, being able to say, okay, your tummy hurts. Are you feeling fearful? Are you feeling worried? Is something bothering you? Is something scaring you? So, and if that's the case, it's normal. It's okay not to be okay. And that works too for our kiddos, letting them know that you can feel you can feel this way, and that doesn't make you a bad kid. That doesn't make you, a bad person. It's just that you, at this moment, you're feeling fearful, you're feeling anxious, you're feeling out of control, and that is what certain behaviors or certain choices are being made. So bringing awareness and normalizing it are some of the biggest tips that I can provide.
Nice. And that's also important as well. You said, locating where they feel the stress, and that's something that we learned in play therapy for those that are 10 and below. They're not able to use those words, so we have them draw, or we just monitor how they play. And that's how we find out where their stressors are, or, what's bothering them, or what's going on in their home, that it tells us that. And so when it comes to parents, I'm glad that you said that, to find where it is that they're hurting, or where on their body they're feeling something, because that's exactly how they, can communicate to us, instead of saying, oh, I'm stressed, mom. Some kids may say that. They may say, gosh, I'm stressed, mom, but other kids aren't able to.
Or even if they say, I'm stressed, okay, what does that mean?
Yeah.
Okay, tell me about that. Tell me, let's have a conversation about it. Let's connect about what that being stressed means. Because again, as I said earlier, stress varies, and what's stressful for me, it's not going to be stressful for you at all. And that happens, for our kiddos. That's how traumatic experiences, take place. And, on trauma reactions to situations. We may experience the same situation and you might be okay. You may push through and go and not have any repercussions from it. And then I may have different repercussions and different ways of experiencing it and feeling it. So it's essential to pay attention to those trauma reactions that our kids, our adults, teenagers may be having.
Excellent. Okay. And with that, someone asks, how do I separate the role of parent and teacher?
That's a great question, because now a lot of parents are having to be teachers too. Absolutely. And one of the things that the best that I can recommend is, you're not the teacher, and that is one of the things. There is, in my experience, it has been literally impossible for me to be able to teach my kids the same way that in the classroom they learn. And it's not only because, I'm not aware or I'm not capable, as some parents may feel. I'm guilty of it as well. How come I went to school? How come I'm not able to teach my child this? But look at the environment. Our homes, unless we're homeschooling our kids and they've been homeschooled, our homes is not a classroom. So that right there makes it more and more difficult for our kiddos to have the essential learning environment that they need to be able to understand and process what we're teaching them. So give yourself a break, do your best, know that if there's something that you don't know, your child don't know, and you don't know how to explain it, reach out to the teachers. And if they're not able to provide the answer, just take a deep breath, walk away, and let it be.
Absolutely. Because it's okay to not know, right?
Yes, that's correct.
Here's the other portion to that question. So that question was, how do you separate the role of a parent? But this question is, how do parents manage both work and homeschool?
That's tough. Again, because our home is not our office. That's not our job. And being able to do both things at the same place, everything comes together. So one of the tips that I can recommend is having a specific place where you do your work, and don't variate from it. If you do it, if your workstation is, like, let's say, the living room, the dining table, make sure that every day you get out of bed and you get ready for work. Like, if you were going to work, I recommend, you put on work clothes, you fix your hair, you do your makeup, if that's what you normally used to do before, and sit in your workstation. Now, you may have your child also working in that same dining room table, but if you're able to have them, let's say, working somewhere else, in the house, that way they can have their own privacy, that way they can have their own space, please do so. If it's not possible, just have them have some headphones, as they do their work, to have specific times for breaks, where if the child, for example, needs some assistance, you say, okay, in the next 5 minutes, I'm going to take a break from work and I can help you with that. Rather than the moment the child needs some help with homework or something that they don't understand, you stop immediately and run to assist. So essentially it's developing structure. Okay. Yeah, developing a structure for you and for the child that you are also trying to help with their work.
Very good. Very good. Structure.
Yes. And a structure that works for you and your family. Remember, teachers may send, some best practice schedule, but if that does not work for your family, there's nothing that you can do. So make things work to the best of your abilities, and communicate with the teachers.
Yeah.
Let them know, this is impossible for my family. I have to work. I'm working from home. So can my child turn in the work later in the day? Rather than can the child just watch the videos, the recorded lessons? Can we have some alternatives? So openly communicate and make those connections with the teacher so they understand your situation.
Understandable. Very good. Very good. And here's our last question of the night. So this question says, when would you recommend seeking professional help for a child, both a stressed child or just a child, period? And is there a certain behavior that would warrant intervention?
I will say that any moment that you start noticing that something is off, any of the symptoms that we talked about earlier, you can definitely consult with a professional. It is very important to know that if you come to my office and I do an assessment and you let me know as a parent, these are my concerns, these are the things that are happening at home. If during my evaluations for the different assessments that I will do to you and to the child and learn about the family composition, if I notice that there is no necessarily for extensive intervention. Let's say that I have to see the child or even the adult 8 to 10 sessions. I may just say, okay, this is a consultation. These are the recommendations that I made, and go ahead and try these things. And if you need, I can see you next month again, just to touch bases, and check in and try to figure out what is happening. Or I can say, okay, let me see you for 2 to 3 sessions, and then we can see how things, progress, and I can give some tips, some recommendations for you and the child and try to figure it out. So a lot of the things will come from that first intake assessment, that we will do to try to figure it out how lengthy the treatment can be. If it can be something that can only last 1 or 2 sessions, and some recommendations and adjustments at home will do the trick. Or if we need a little bit more intense and prolonged services.
Okay. And I'm sorry, I have one more that just came through.
That's okay.
And this one is pretty good. It says, could a parent's teaching style be causing their child undue stress?
Definitely.
Yes.
Definitely. I will say so. And I can actually relate to that because whenever the pandemic started, my thought process was, I need to have a specific schedule for my kids. I developed all of these things because I still had to continue going to work, going into the office as a mental health professional. I am considered essential staff, so I continue to go. My husband was able to work from home, so he stayed. So at home with the kiddos, I developed this very concise schedule, step by step, what needed to be done. That did not work. That made all kinds of disaster, especially for my teenager, my 13-year-old. And so I quickly needed to learn that was not going to do the trick, and kind of be a little bit more loose in terms of what was going to work for each one of my kids. And I say that to say that each child may need different approaches. And definitely as parents, we need to check ourselves and trying to figure it out. What I'm doing is supportive of my child. What I'm doing is supportive of me. And am I adding on stress, not only to my child, but to myself too? And if that is the case, how am I presenting? Is this helpful or unhelpful? And if it is unhelpful, what do we need to do to modify the strategies that we're trying to implement? And am I the best person to implement the education for our kiddos? Sometimes we may not have any choice. I'm blessed, that my husband was able to step in and he was able to help my 13-year-old. He said, I'm going to do what I need to do. And I'm like, okay, as long as you turn in your work, go for it. No problem. But it is essential for us to pay attention to those things. So yes, indeed.
All right. So, and that's true. I have friends who are teachers, I have friends who are teachers and parents,
Yeah.
and, you know, friends who are working remote and also trying to teach. And it's been something else.
Yes.
Just listening to the stories and also hearing it, and also, you know, monitoring those things that are going on has just been something else. We have a scenario here. If you don't mind me asking, this one, we'll make this the last one. Is that okay?
That's okay. Go for it.
I don't want to take up too much time, but this one says, in some situations, my school-age child asks me for help while he is in class. I feel I'm sometimes stepping on the teacher's toes and stepping in. Should I be okay with helping him during class, or recommend that he waits patiently for the teacher to help him out?
I would recommend, I don't think it's necessarily stepping on the teacher's toe. It's trying to figure out how much interruption that will be for the rest, you know, of the class, if it's a live synchronous or asynchronous modality, depending on how the school is doing it. But I would say to encourage your child to be patient, and to model that waiting, and kind of, you know, or empower the child to ask the teacher if the child is able to, because this will be exactly what will happen if they will be in the classroom. You know, you will not be there, and the hope is that eventually we are going to go back to the classrooms, you know, have some type of normalcy of what it used to be. So encourage your child to be assertive and ask the teacher, either by sending the teacher a message. And if your child is too young that they're not able to do that, you can assist, you know, in that. Let's ask your teacher, you know, let's see, you know, what answer. Let's send her an email. Let's send her this question and see if the teacher is able to jump in. Now, if the teacher is unable to, then of course, you know, help your child if you're able to, and then communicate with the teacher the struggles that your child is having with their style, or with, you know, their changes, or whatever it is that the child is having. So handle it the same way that you will handle it if the child will be in the classroom and come home to you and say, my teacher is taking too long to answer my questions, they're not answering them, I don't understand, or any of those things.
Excellent. Very good advice, you know, because I know they have a lot of questions on, God, am I doing this right? Because it's so new.
Correct.
And like, it's not the norm, and it's just, you know, you're having to do a new type of math. You know, we're used to 2 + 2.
Correct.
And it equals 4. We do that, and then, but now it's a long, drawn out, you know, math problem that shouldn't even be that drawn out. But, you know, the thing is, they have a lot of questions about that, and they're wondering, am I doing this right? You know, and not even as a parent, but just during this whole pandemic as well. Am I doing this right? Am I okay?
Correct.
Do I need to seek therapy? Like, what's going on? Things are new and my body is changing. You know? So, you know, they do have those questions that are going on. And I'm so thankful that we were able to have you on to give us those tips, strategies, and tools that they can take with them in everyday life and say, okay, am I experiencing this? Okay, maybe I do need to incorporate exercise, or I do need to take my me time, or I do need to delegate. I do need to create these boundaries.
Yes.
It's very vital right now during this whole pandemic that we take care of self. You know, we don't have the things that we used to have. And so being in solidarity for those who are living just solo, or for those who are living, you know, with their husband, wife, partner, whatever, you know, you're dealing with different things now. You're seeing them all the time. You're seeing them 24/7, you know,
yes, indeed.
and there's no escape. You know, not that you want to escape, but it brings you back to me time.